We're diving deep into a topic critical for every physical therapist: spinal cord injury, or SCI. This isn't just about understanding anatomy from a textbook, it's about grasping the profound, life-altering impact on a person's entire world. An SCI is more than damage to a bundle of nerves. It's a sudden and dramatic shift in someone's ability to move, to feel, and to interact with their environment. To understand SCI, first understand the spinal cord. Picture it like a skyscraper where each floor has specific functions. 4 main sections: cervical, thoracic, lumbar, sacral. Each section sends nerves to defined body areas. Key rule: the higher the injury, the more widespread the effects. Cervical: head, neck, diaphragm, shoulders, arms, wrists, hands. Injury here can affect the body from the neck down. Thoracic: trunk control, posture, chest back sensation, stability. Lumbar: lower body power, hips, legs, standing, walking, stairs. Sacral: feet, ankles, bowel, bladder, and sexual function. We classify by the lowest segment, with normal bilateral motor and sensory function, the neurological level. If function is full to C5 but not C6, that's a C5 SCI. This guides assessment, goals, and treatment plans. Cervical injuries. C1, C8 have the widest impact. C1, C3 involve the diaphragm via the phrenic nerve. C3, C5. Ventilatory support is typically required. These patients are dependent for all daily care. At C4, some can breathe independently or be weaned over time. They may drive a power wheelchair and access computers with mouth or head controls. C5, shoulder and biceps. Elbow flexion enables feeding with a universal cuff, pressure relief, and assisting transfers. C6, wrist extension enables tenodesis grasp for functional grip. C7, triceps for elbow extension, pushing up and improved transfers. C8, more intrinsic hand function, fine motor improves. Each level down the cervical spine unlocks new potential for independence. Below the cervical spine lies the thoracic region, T1, T12. Thoracic injuries spare the arms and hands. This is a massive advantage. Result: paraplegia, lower body function is impaired, upper body intact. T1 resembles C8 in hand-arm control. Trunk and sensation are the focus. Higher thoracic levels have poor trunk control. Sitting balance is challenging and may need supports. Rehab targets lats and shoulders to compensate, teaching prop sitting, safe weight shifts, and pressure relief. Descending levels restore core control. T10 patients sit more confidently than T4. More trunk stability boosts transfers, dressing, and ADLs. Lower thoracic, T10, T12, may walk short household distances with KFOs and walker crutches, but wheelchair remains efficient. Standing offers psychological and physiological benefits. Set goals accordingly. Now the lumbar and sacral levels, drivers of legs and pelvic function. L1, L5, hips, knees, and some ankle movement. Full trunk and arms are intact. Functional goals often center on ambulation. L1, L2, hip flexors enable lifting the thigh. CAFOs, plus crutches become realistic. L3, knee extension stabilizes the leg for stance. L4, ankle dorsiflexion improves foot clearance. Often only AFOs are needed, saving energy. Case: an incomplete L4 SCI progressed from walker and heavy braces to forearm crutches, and finally a small AFO, home and short community ambulation. Sacral, least severe motor. Many walk with minimal bracing. Biggest challenges are bowel, bladder, and sexual function. Expect near normal gait yet lifelong pelvic organ management. PT support and education are vital. Injuries are often incomplete. Damage can be messy and uneven. Patterns of weakness and sensory loss create recognizable syndromes. Complete, no motor or sensory function below the injury. Incomplete, some function remains. Sacral sparing, anal sensation or voluntary sphincter contraction signals preserved pathways and better prognosis. Most seen: central cord, brown sequard, and anterior cord. Each arises from damage to specific cord regions. Recognize the map, predict recovery. You don't treat central cord like anterior cord. Plans must match patterns. Level: Saturn the floor. Syndrome: Saturn, which rooms, tracts, are affected on that floor and below. Motor, sensory, or both. Precision targeting of weak muscles and impaired sensations separates good therapists from great ones. Central cord syndrome is the most common incomplete SCI, often due to neck hyperextension in older adults with stenosis. Arm and hand fibers are centrally located. Leg fibers sit more laterally. Hallmark: much weaker arms and hands than legs. Patients may walk with a device yet struggle to button a shirt or hold utensils. Prognosis for walking is generally favorable. Therapy emphasizes fine motor tasks, dexterity, and proximal arm strengthening. Typical sequence: legs return first, then bladder, then shoulders and biceps, and hands last, if at all. Set expectations, celebrate walking milestones, and persist with meticulous hand training. Brown sequard: one half of the cord is damaged, often from penetrating trauma. Same side, motor and proprioception lost. Opposite side, pain and temperature lost. Prognosis for ambulation is generally good. Anterior cord: ischemia to the anterior 2/3 of the cord. Loss of motor and pain temperature below the lesion, but proprioception, light touch, and vibration are preserved. Motor recovery is poorest among incomplete syndromes. Maximize residual function and train adaptive equipment use. Tailor goals and interventions precisely to the pattern and collaborate across disciplines. We've covered levels, syndromes, and outcomes. Now make it actionable. Start with a precise assessment to define the neurological level. That level dictates strengthening targets, sensory re-education, and achievable functional goals. Education builds trust. You have a C6 injury. Your wrist extensors work. We'll leverage that for grip and independent transfers. Think beyond movement. Prevent pressure injuries, manage autonomic dysreflexia, support breathing, and monitor orthostatic hypotension. Teach pressure reliefs and safe position changes. Great SCI PT blends deep knowledge, endless creativity, and profound empathy. Listen to goals, celebrate small victories, and keep learning. You got this.